was just like fed up with it. And I was like, all right. And so he said, let's do these basic things. And an X-ray showed that she had these little dots that on X-ray they look moth-eaten, and these were metastatic breast cancer lesions. And so she
Oh.
couldn't move because she had these in her ribs and spine. She
Mm.
had a lot of pain from it. And they actually did something that's very rare, which is called the radiation oncologist, who then came, because this is the only radiation oncology emergency really there is, or one of the very few, where they could radiate it and relieve her pain so she could, um, you know, uh, move without so much discomfort. And it was one of
Wow.
those things where, like, you just don't know what you're missing. And he
Mhm.
rightfully so is like, you could have checked for adenopathy. And honestly, at this point, I can't remember if I did. I was so like freaked out, like she wouldn't move. She just kept telling me she was in so much pain she couldn't move. And I was like paralyzed, by that. So the long story short is like when you have those findings, there's a reason for that finding. So your body's responding to something. In that case, is it your device on that side? Was it somehow creating that response? And I would always have to say I would worry that that's the reason. I wouldn't know why that was the reason. So any device can cause
Mhm.
acute inflammation and then obviously chronic inflammation the longer it's in place.